Hello everyone, I'm Dr. Prachi Kulkarni, fertility specialist, 49 Fertility Center. Today I'm going to talk about hydrosalpinx. What is hydrosalpinx? Why it occurs? What is the treatment for hydrosalpinx? So we will discuss about all this. So this is uterus, these are the fallopian tubes, and these are the ovaries. Hydrosalpinx means, hydro means fluid, salpinx means the tube. So fluid collection in the tube is called hydrosalpinx. So why it happens? The cause for hydrosalpinx is any infection. So infections such as sexually transmitted diseases like gonorrhea, chlamydia, which can cause pelvic infective diseases, pelvic inflammatory diseases, they can cause damage to the tubes and can lead to accumulation of the fluid in the tubes. In India, the most common cause for hydrosalpinx is also genital tuberculosis. So tuberculosis can affect your uterus, its lining of the uterus, but at the same time, it may also affect your tubes and can cause damage to the tube so that the tube accumulates fluid. So other than these infections, other causes for hydrosalpinx can be pelvic endometriosis, wherein the same reason there are inflammatory changes and there might be coexistent infection which causes the fluid accumulation in the tube, and even in endometriosis you may have hydrosalpinx. Suppose if you have hydrosalpinx, what should be the treatment? So the treatment of the hydrosalpinx will depend on multiple things. That if the infection is active, your doctor may treat the infection with the antibiotics first. Taking the antibiotics may cure the infection, but the fluid collection in the tube may not go away. So what we have to do, if the tubes are persistently showing fluid and if your doctor is suggesting to go for a treatment to clip the tubes from the uterus, where the connection is there. So usually what happens with the hydrosalpinx is this fluid collection, if it is connected inside to the uterus, the fluid may keep dribbling inside the uterus slowly, and it can have bad effect on the lining of the uterus. Also, it can have an effect on the embryo. So if you're trying to conceive naturally, the embryo may not get implanted in the uterus because of the fluid. It may get washed off. Even in IVF, when we are seeing hydrosalpinx with fluid in the cavity, we suggest either salpingectomy, that is the removal of the tube laparoscopically, or we suggest to go for tubal clipping, which is the disconnecting the tubes from this end, which is connecting it to the uterus. So this fluid, which is not a good fluid, it's a toxic fluid for the embryo, can damage the embryo, can mechanically wash off the embryo, can have bad effects on the lining of the uterus, so it becomes non-favorable for the implantation. So this reduces the chances of implantation by 50%, also increases the chances of miscarriage. If you conceive with an hydrosalpinx, miscarriage chances are doubled. So we always advise to disconnect this hydrosalpinx from the uterus so that this fluid can no more enter the uterus and your IVF success chances will improve. So many times it happens that patients come to us asking this question: Doctor, I have had an ectopic pregnancy. What should I do to prevent another ectopic pregnancy, or what should be an ideal treatment to conceive? So, if you have had an ectopic pregnancy in the past, that means that pregnancy has happened in one of the tubes. The treatment which might have happened at that time can be either medical management or surgical management. Medical management is giving injections to stop the pregnancy from growing, and surgical management means either they have done the salpingectomy, that is removal of the tube, or they have disconnected the tube from this end and taken some part of it out. So these are, or sometimes rarely they might have just made a nick on the tube and just removed the ectopic pregnancy but left the tube as it is. So these are the different ways you might have been treated for the ectopic pregnancy in the past. So based on that, your doctor may suggest you what should be the treatment to conceive from next time. So suppose if your one of the tube has been removed, so that means this tube is not present. If the other tube is healthy at the time of surgery, it is documented in the notes that the other tube is healthy and patent, that is open, then your doctor may suggest to, if you have good reserve also, your doctor may suggest you to go for an IUI, wherein we take the husband's semen sample and put it inside the uterus around ovulation, if you're ovulating from the side where the tube is open or where the tube is present. So, but it is important to document this tube is open. So this is done either by an HSG test or SSG test, where we can document that this tube is open. Suppose if this tube is open but shows sacculation or any other bleeding or other problems, then in that case your doctor may not suggest you to go for IUI but advise you to go for an IVF, considering a damaged fallopian tube. Or if your surgical notes say that other tube is also seen to be damaged or having hydrosalpinx, in those conditions also your doctor may not ask you to go for IUI but directly advise you for an IVF. So based on the previous history of ectopic, these can be the treatment options. So what is the recurrence risk if you have medically managed ectopic pregnancy? Means both of your tubes are present, you have been treated medically for ectopic pregnancy. So in general population, the incidence of ectopic pregnancy is around 2%. But in patients who have had ectopic pregnancy in the past, this incidence is on the higher side. So you may have a chance of recurrent ectopic around 10 to 20%. So what we advise is to check for the patency of the tubes, preferably by HSG or laparoscopy. If on laparoscopy, if we are seeing any damage of the tubes like sacculations or hydrosalpinx, then better to consider going for delinking of the tubes and going for an IVF. If your tubes are looking healthy, they are patent, then you may consider going for an IUI. But outside appearance of the tube looking normal may not always confirm the function of the tube, or may not always tell us that you will not have ectopic pregnancy in future, because ectopic happens in the damaged tubes. So the inner layer of the tube or inner lining of the tube may be damaged, may be constricted or smaller in diameter. So you have to be, if you have patent tubes after ectopic pregnancy and you are trying with medicines, or you're trying to conceive with IUI, you have to be vigilant that if you have again recurrent ectopic pregnancy. So what you should do is immediately you should get on missed period, get beta HCG test done and see your doctor, and an early scan will prevent for the ectopic pregnancy to develop further and detect early, so that you can receive the treatment for ectopic pregnancy early. So this is about the medical management, medically managed ectopic pregnancy. So based on this, you can discuss with your fertility specialist what are the treatment options. And if your tubes are normal, maybe there is 70-80% chance that, and you are young with good egg reserve, with husband semen parameters being normal, then you may conceive naturally around 70 to 80%. But you have to be vigilant about the ectopic pregnancy. Thank you.